Perhaps more than any other facial feature, our eyes seem to have a way of conveying our outlook on life. Surgical treatment for tired-looking eyes or puffiness is called a blepharoplasty. This puffiness of the eyes is due to the fat around the eye starting to bulge through the natural barrier that anatomically holds it back. This fat that normally cushions the eye in the eye socket bulges forward. Many times this is a genetic problem, so many people can link this problem back to a parent who had a similar type problem. There are two different ways that we go about correcting the lower eyelid area. The first method may involve injection of a filler underneath the eye where the fat is protruding. This can help to smooth the puffiness and decrease the shadowing caused by the loss of a smooth transition from the lower eyelid to the cheek. The alternative method is to remove the fat or reposition the fat with surgery. This is called a lower eyelid blepharoplasty. Either of these options can be considered depending upon each person's individual situation and what they desire. There are some patients trying to prepare for that special event like a wedding, and for them, they may be looking for a temporary solution, while others are looking for a more long-lasting solution. For these patients, surgery is a better option. Either option can achieve a very nice result if performed on the correct individual. The key is matching the right operation or procedure to the right patient. Both upper and lower eyelid surgery is often done under local anesthesia. For this reason, this is one of my favorite operations to perform. These procedures can be done in our office operating room with the patient awake. We generally have our patients take oral medication for sedation prior to surgery. This just makes it more comfortable for them. On the upper eyelid, we typically remove both the redundant skin and any bulging fat. It is important not to over-resect the fat or skin. A youthful eye has volume. A common mistake can be to remove too much skin or fat, creating what I like to call nursing home eyes, and nobody wants those. Upper eyelid surgery frequently involves more than just removal of skin, muscle, and fat of the upper eyelids. We must evaluate the position of the eyebrows as well. For a woman, the arch of the eyebrow should be about 8 to 10 millimeters above the bony orbital rim. If there is a crowded distance between the eyebrows and the upper eyelid margin, then removal of skin will not create an opened, youthful appearance of this area. In this case, you may need a brow lift. Recovery after a blepharoplasty is generally uneventful. One common problem is with bruising around the eyes. So, from a cosmetic standpoint, patients have to be aware that this bruising is normal and, at least for women, can be camouflaged with makeup. From a pain standpoint, the surgery is well tolerated. Most patients will not need any pain medication after surgery besides maybe a Tylenol or ibuprofen. Many patients will ask me if they need to treat their complete face at the same time. They're concerned that if they only treat their eyes, then there might be a mismatch between the eyes and the other portions of their face. Well, this has to be evaluated on an individual basis. Everyone ages differently. Some patients experience more aging around the jawline and the neck, while other patients experience more signs of aging around the eyes. There is definitely not a one-size-fits-all for every patient. Each person must be evaluated and a treatment plan formulated to correct the issues that bother them the most. The goal with all of our facial rejuvenation procedures, including eyelid surgery, is to achieve that natural looking result. We want is an improved, fresher, rejuvenated you. We don't want you to look different. We want you to look more rested and happy. Our patients are generally very pleased at what we are able to achieve. What is involved with a lower eyelid lift or blepharoplasty? This depends upon your anatomy and your overall concerns. We will first evaluate the overall harmony and symmetry of your entire face and determine how the shape of your lower eyelids fit into the overall picture. The plan can involve non-surgical treatments such as soft tissue fillers, Botox, fat, or a laser treatment, and in many cases, surgical procedures are also discussed. The surgical procedure can vary dramatically from patient to patient since everyone's concerns and anatomic features will be different. What is different about today's lower lid surgery is more attention to detail and avoiding a hollowed out appearance by over-resection of fat. There are several anatomic considerations. Bulging fat pads of the lower eyelids. This fat can be removed or more often repositioned to fill in areas of volume loss such as the tear trough zone and other areas of hollowness. Loose skin. Mild cases of loose lower eyelid skin can be treated with a CO2 laser, and more significant cases can need skin removal. Lower eyelid retraction must be evaluated, and in some cases must be tightened in order to avoid a hound dog type of appearance. Lower lid bulge due to muscle sagging is also assessed. If the muscle is sagging, creating bulges and mounds, it can be resuspended to its more youthful position. Hollowing under the eyes contributes to the shadows and dark circle appearance. Overzealous excision of fat in this area can lead to what I like to call nursing home eyes. It has become much more common to fill the lid cheek junction with this fat than to remove it completely. Dark circles are a particular concern. The main problem is that the skin of the lower eyelids is very thin and translucent. The muscle is directly under the skin, and if the skin is thin, the color of the lower eyelids becomes dark. Once the skin is tightened and any contour deformities and bulges are corrected, there is less shadowing, and this goes a long way in correcting the dark color of the lower lids. The relationship between your eye and the bony orbit. This determines how deep set your eyes are and has implications on hollowing of the peri-orbital zone and that nursing home eye appearance that we all want to avoid. The results of a blepharoplasty can be dramatic and will typically last 10 to 15 years depending upon the extent of the initial problem and the quality of your skin. The key to having a successful rejuvenation of the lower eyelids always involves proper evaluation and surgical planning, which is directly related to your individual anatomy and goals. If you'd like to improve the appearance of your lower lids, the first step is to schedule a consultation. During this consultation, we can evaluate your overall appearance. I hope this video has helped answer some of your questions about eyelid surgery. If you have any questions, please view some of the other videos we have on our website.